This is Dr. James, and I was asked a question about lead in the blood. So, in high-risk areas across the United States, lead is typically screened usually at 9 to 12 months and again at 2 years. And this is because young children are particularly at risk for elevated leads. One, for both exposure and to the harmful effects that lead intoxication can cause. So lead intoxication medically is known as plumbism, and elevated lead in your blood can cause multiple different problems. It can cause irritability, headaches, constipation, abdominal pain. It can cause definitely problems with thinking, can cause mental retardation. In severe cases, it can even lead to seizures and death. If your lead level gets too high, it actually has to be removed from your blood through a process known as chelation, which is pretty hard on your body. Usually needs to be done in the hospital, and you have to be monitored fairly carefully. So how do you get lead, and why are the younger ones particularly at risk for that? Well, lead is found in old paint. So in older buildings where they were painted before the 1970s, they would commonly use lead-based paints. And these paints, as long as they stayed on the wall, was okay. But as they would come off and flake, then they would become like little paint flakes that, well, kids could eat. It also becomes part of the dust of your floor. There's also some lead-based pottery. Of course, we had lead plumbing. And then there was leaded gasoline. So in highly industrialized areas, you could actually have lead in the dirt from where there used to be lots of leaded gasoline and contamination of the dirt. So the reason that kids are more prone to this is, well, they're on the floor a lot. They're on their hands and knees. They typically are eating with their hands. Their hands are going in their mouth. So that's one reason. They're also more prone to be anemic. And when they're anemic, you can suffer from something called pica, where you eat weird stuff like dirt or paint chips. When I was in Cleveland, Ohio, elevated leads were extremely common. Again, we were in inner city. We had a lot of older buildings that had lead-based paints. It was highly industrialized, so there would have been lead in the dirt. And if you got anemic and started eating these lead paint chips, then you could have an elevated lead. And so we would screen for these. And one of the common things that we do when you found an elevated lead was you would do an x-ray of their belly, and you can actually see the lead paint flecks show up in their abdominal cavity. So those are your risk factors. So and then the reason that the kids are so much more prone to this and it'd be so bad is, one, they're always putting their hands in their mouth, but two, because their brains are developing so rapidly and growing so fast that any kind of insult that happens to their brain is a lot more important in the very young than it is older. So your risk factors are your little ones that are on the floor. Your risk factors are the area you live in. Do you have an area that has older houses? Do you have more industrialized areas? Make sure that you don't have any lead-based plumbing in older houses. Now that's not something that gets done. And of course that you're not using any lead-based pottery for anything. And so we screen again at 9 months to a year typically, and then at 2. In my area, I hardly ever see an elevated lead. The ones that I have seen are things that, well, they were kind of, a known risk factor. One ate a lead fishing weight. The other one ate a lead bullet. And as these went through their GI tract, then their lead level elevated. So the goal is to get the lead out of them as soon as possible. And if it becomes toxic, then if you have to, then you can chelate them. So that's why we screen it. That's how you get it. And what happens if you do get exposed to it. I hope that helps.